Hello, my name is Zach Griffin, and I'm from the National Research Corporation. I'd like to talk to you about Illuminate. Illuminate is an innovative turnkey program that can help you improve the patient experience, improve your patient satisfaction scores, and generate real-time data that helps you manage your service and clinical recovery. As you know, hospital responsibility for patient well-being no longer stops when the patient leaves the hospital. New regulations, primarily from the Centers for Medicaid and Medicare Services, are partly responsible for this. CMS has developed payment structures that do not reimburse costs for certain patients who are readmitted to the hospital for reasons that could be considered preventable. In addition, the care community has come to realize that quality patient outcomes require follow-up methods to ensure that patients can continue to care for themselves when they leave the hospital. And, of course, hospitals are increasingly being judged on their patient satisfaction scores. Typically, 1 in 5 patients who leave the hospital need follow-up for a clinical or service issue. Some hospitals are trying to identify this 20% by conducting follow-up calls to patients after they are discharged. Nurses will call to ask how discharged patients are doing, determine that they understand their discharge instructions, and ensure that they are taking their medications properly. Other hospitals are calling only high-risk patients. While this is an efficient practice, many at-risk patients will be missed. These follow-up calls can give hospitals invaluable information when patients are not doing well or don't understand the instructions for their medications. Ignored, these are patients who may be heading towards readmission. Follow-up calls are also a way to learn if discharged patients are dissatisfied in some way with their experience. In short, these calls made by nurses identify the red flags. They help prevent readmissions and help with patient satisfaction. They're also very expensive. For example, a typical 350-bed hospital with both inpatient and emergency departments will have about 80,000 patients go through these two departments annually. Let's assume that a nurse makes $40 an hour and can average about 10 patient calls per hour and successfully reaches half of those patients. The attempt to reach these 80,000 patients will result in an annual cost of $320,000. This cost is reflective of only the nursing time required. It does not take into account other expenses that must occur for successful programs, such as juggling nursing schedule demands, development of robust tracking tools, development of easy-to-use reporting solutions, creation of an internal education program, and creation of communication to patients to improve outreach success rates. Unfortunately, most hospitals don't have the manpower or financial resources to do this consistently or effectively. In fact, of the organizations that create a post-discharge call program, approximately 80% fail due to operational and expense challenges. Operational challenges include commitment from stakeholders, consistent implementation, and sustainability. And expense challenges include time, qualified personnel resources, and finances. The ability to generate a positive return on investment makes selling a new program easier for project champions. However, it is difficult to measure results when the data is both nominal and inconsistent, and when no key metrics or trending is being produced for analysis. While most hospitals recognize the importance of a post-discharge system, very few have implemented a successful and sustainable program due to these mitigating issues. To address this challenge, the National Research Corporation, NRC, has developed Illuminate, a turnkey patient discharge and outreach program. Illuminate is an automated system using voice recognition software which facilitates service and clinical recovery within the critical 48 hours of a patient being discharged from the hospital. The system checks on patients when they arrive home through automated phone calls, identifies patients in need of additional attention, and then alerts the healthcare facility to triage the patient and resolve the issue.
The Illuminate program has helped us achieve better connections with our patients after they are discharged. This connection and access to our clinical team has assisted us with reaching improved patient satisfaction scores and has improved the patient's experience. The program also provides us with compliments and thank yous for our physician and hospital staff. Often hearing this praise from the patients themselves makes all the difference.
With Illuminate, sustainable success is achieved through 4 essential components. First, Illuminate provides turnkey implementation, providing a robust communication system. We supply education materials for both staff and patient, and hospital-wide communication plans. Second, nurse champions are identified using predetermined criteria. The Illuminate program helps to train nurse champions to resolve high-risk patient issues and provides ongoing clinical and service recovery coaching. Some individuals in your organization will be better suited for this role than others. The third component is patient outreach. Our automated system reaches out to 100% of patients within 48 hours of discharge. If the phone call is not completed or the system reaches the patient's answering machine, the calls are repeated automatically. The organization receives an email from the Illuminate program each afternoon alerting them to any patient issues that need resolved. Nurse champions ensure that each patient is called back the same day. One of the most important benefits of the Illuminate program is the real-time data that is generated. You are provided with a secure online portal where you can obtain real-time patient satisfaction and quality metrics. In addition to online reporting, monthly program evaluation reports will be generated to summarize program performance.
Illuminate is an important tool that helps us identify areas for process change. In hospitals, more often than not, it's the little things that have a positive impact on our patients throughout their admission. These subtle changes should not be minimized.
Let's walk through a typical program. As patients are being discharged from the hospital, they go through a complete exit package. The patients are told to expect to receive a phone call from the organization's automated system. Nurses are instructed to emphasize the importance of this call and the hospital's need for the patient to respond to the call. In addition to the verbal delivery of information, a formal letter explaining the program is included in the patient's discharge packet. A natural voice recognition system that understands patient responses calls the patient during their first day home from the hospital.
Hello, this is Alpha Hospital calling about your recent experience with us.
The patients hear a voice that asks key questions about their experience to find out how the patient is doing at home. The system then takes the patient through a number of predetermined questions to verify the patient's current well-being, whether they have questions about their medications, if they have any service concerns, or if they would like a callback from someone at the hospital. If the patient requests a callback or answers any of the other questions in a way that indicates risk, your hospital nurse champion will be alerted via email, and the nurse can contact the patient directly to conduct triage. If the phone call is not completed or the system reaches the patient's answering machine, a message is left giving a phone number that the patient can call to respond. In addition, the calls are repeated over the next 3 days to make contact with the patient. Your organization will receive a HIPAA-compliant email from Illuminate each afternoon that will lead to the names and phone numbers of the patients who requested a callback or whose answers triggered the system to identify a need for a direct call. Your nurse champion specifically trained and dedicated to making these calls ensure that each patient is called back the same day. Calls are divided based on need and issue, so that the nurses in the program are only calling those patients who actually need nurse assistance and may be at risk. Your nurses may elect to send service-related issues such as housekeeping or dietary to other hospital staff. When the nurses conduct the personal callbacks to the patients, it's recommended to have access to the patient's electronic medical record. These are experienced nurses who are familiar with the patient's medications. They can provide advice about their continuing care and recommend that the patient call a physician, urgent care center, or provide other assistance as needed. Robust reporting allows you to see in real time how discharged patients are responding by unit, which provides valuable information for process improvement. In addition to the follow-up questions and triggers, patient comments are recorded so that if specific providers are praised, they can receive direct feedback from the patients whom they still remember, a benefit of the 48-hour follow-up period. We have found that staff recognition has been a significant factor in creating positive energy and staying power around the program. Each clinical department receives a weekly report summarizing the calls related to patients from their specific area. If patterns emerge, the appropriate nurse manager can attend to the issue and discuss it with staff. The emphasis on real-time information is key for this program's success because the hospital staff can recall the specific patient issue rather than hearing about the problem a few months later and trying to recall circumstances. The ultimate goal of the Illuminate program is to ensure that every patient gets what they need in terms of information or care, that they are not readmitted to the hospital unnecessarily, and that all service problems are addressed promptly, thus providing the patient with a positive care experience.
Illuminate has provided us with the means to consistently provide post-discharge phone calls in a timely manner. It is our role as organizational leaders to ensure we are visibly talking up the program to increase our call success rate. The positive scores tell the story. Our mean scores are significantly higher when we are able to touch base with a patient once they are back home. Most often, it's just the security of knowing we are here for them even after they are discharged.
Since Illuminate's launch, program outcomes studied have been very positive. One of Illuminate's users is a 700-bed hospital in Florida, which implemented the Illuminate program in 2 units and has since expanded hospital-wide. In just 3 months, they reached 844 patients from the original 2 units, and 168 patient issues were identified. The outcomes? Increased would recommend on their HCAHPS survey by 5.4 percentage points, while the remainder of the hospital stayed constant. And 95.6% of patients with key alerts stated on follow-up HCAHPS surveys they would definitely or probably recommend the hospital. In addition, our clients have shared some qualitative benefits that have been recognized after implementation of the Illuminate program. They value the ability to gather real-time data as opposed to retrospective data that is often weeks old. The reporting system allows information to be disseminated directly to each department so that care providers are receiving the information they need to learn and grow from patient feedback. Illuminate has stimulated additional attention and conversation among hospital staff about the importance of seeking feedback from patients. The Illuminate process lets patients know right at the start of their discharge that they are cared about. Let's do a theoretical but very conservative example of how Illuminate could impact your organization. Assume there are 100 complaints annually regarding your inpatient process. According to Zamowski, 2004, an average dissatisfied patient tells 25 other patients about their experience. Therefore, the 100 original complaints could cause 2,500 potential patients to have negative perceptions about your hospital. And with an average inpatient generating annual revenue of $10,500, the long-term revenue being put at risk from patient dissatisfaction and negative perception is over $26 million. Illuminate can help you eliminate dissatisfied patients and retain potential revenue. So let's review the advantages of the Illuminate discharge solution. It's a turnkey, cost-effective, and comprehensive patient discharge outreach program. You are provided a complete communication system, including staff and patient education material, and a hospital-wide communications plan. We help identify and train nurse champions so they can resolve high-risk patient issues. Ongoing clinical and service recovery coaching is also included. Our natural voice-language response system ensures 100% of patients receive outreach within 48 hours and helps identify high-risk patients. Nurse champions receive HIPAA-compliant emails regarding any patient answers that trigger an alert so they can contact them and resolve issues in a timely manner. Data can be recovered via a secure online portal, including daily patient satisfaction and quality metrics, department-specific reports, and monthly evaluation reports, which help you drive process improvement. The outcomes that have been achieved using Illuminate are improved patient experience, increased patient satisfaction scores, process improvement using the real-time data generated by the Illuminate program, and potentially decrease preventable readmissions due to timely resolution of patient issues. To learn more about Illuminate, call National Research Corporation at 402-475-2525 or visit illuminate.nrc.com.